Hi there again. I'm Jason. Last summer, I went on an expedition to Kyrgyzstan, and besides the gear I needed to make sure that I could make some summit attempts at altitude, I also needed to think about medications. There's a reason travel medicine is a thing, with the crowds and potential exposure to what would be for us uncommon viruses and environmental realities. Then you can throw in the fact that I have blood cancer that impacts my immune system, am asthmatic, and was heading to altitudes that can risk various altitude-related illnesses. And you can watch a whole video we did that was a primer to acclimatization and the risks of acclimating poorly. There's a link in the description. So today's video is a rundown of all the medications I took with me on that trip, along with a very brief discussion on why. Think of this as a summary video, a starting point for researching and talking with your physician on medications you might want to consider. Each medication is worthy of its own full-length video when it comes to things like clinical evidence, side effects, interactions, dosing, and all of that. It's way more than we can get into in a couple of minutes, and is something your doctor or pharmacist should talk to you about anyways. Trying to loosely categorize things, let's start with vitamins and supplements. Many of us might already have things that we take daily, like my multivitamin, and we will likely want to keep that up, considering that expedition foods can often lack diversity, so micronutrients might be a concern. I also have a daily vitamin D supplement due to a weakened immune system, but more on that later. We will also very likely be in pain at some point. I typically bring an NSAID or non-steroidal anti-inflammatory drug. NSAIDs work throughout the body, blocking chemicals that cause inflammation. NSAIDs come in many varieties, like ibuprofen in Advil or naproxen in Aleve, but I prefer a prescribed version, meloxicam. It is stronger, with less GI side effects, and also is taken in fewer doses, which can be a big deal when on the move and busy. I also bring acetaminophen, and we don't actually know how it works, but we know it works on the central nervous system. It can be stacked together with NSAIDs, though, if things get bad. Acetaminophen's most common brand name is Tylenol. I also take with me a topical analgesic like benzocaine, which can be found in Anbesol, which is for oral pain. Some people prefer to use clinical strength versions, thus demanding a prescription, maybe lidocaine and prilocaine gel. That is basically what your dentist rubs on you to numb part of your mouth before giving you the injection of the even stronger numbing agent. Besides mouth pain, the gel can be used for blisters, numbing the pain until we get something else, like Compeed cushions, over the sores. Along those lines of first aid, I also bring a topical antibiotic for cuts that also has a topical analgesic like Promoxin. I typically use Neosporin plus pain relief. We will likely also need a few over-the-counter medications for more typical illnesses, so I take along both daytime and nighttime cold and flu medication. The common brand name might be Dayquil and NyQuil. Yes, they are different. The former is non-drowsy and the latter is decidedly not, plus the latter has a cough suppressant to also help us stop from waking up a lot. We need to think about GI distress too. First, an antidiarrheal like loperamide, such as in Imodium, which slows intestinal contractions to allow more water absorption, and is what I typically bring, but there are other options with other mechanisms of effect. And the same goes for laxatives that can have many different ways of providing relief. I usually bring something mild like Colace, which increases the absorption of water and fat in stool. If things get really bad, we might need an antibiotic, often due to contaminated food or water. Like everything else here, there are options that vary across more or less effectiveness for certain types of bacterial infections, such as GI versus respiratory versus urinary tract, etc. Vary across frequency of dosing and vary across the severity of side effects. I most often bring azithromycin, but often our destination's particular risks may dictate. Some people may choose to bring an antiviral, but these often have to be targeted at specific families of viruses. I, for instance, am particularly susceptible to COVID becoming life-threatening due to a blood cancer that affects my immune system, so I took Paxlovid to Kyrgyzstan with me, and that also meant that I needed a test kit. Speaking of personal risks, we all have them, and sometimes have specific medications that we obviously don't want to forget. Besides the blood cancer, I also have asthma, so I have a daily inhaler of beclomethasone and an emergency inhaler of albuterol. I have had a kidney stone, experienced while trekking the Tour de Mont Blanc, the pain causing me to hike without any calorie intake for the last 5 days of that trek. So now my urologist has me take along tamsulosin hydrochloride, like Flomax, as I am now more at risk of repeating kidney stones. I have seasonal allergies, and exposure to new grasses and weeds could cause a reaction, so I have cetirizine, such as in Zyrtec, which starts quickly but can also be taken daily as a preventative. And I have severe food allergies to tree nuts and seafood. For most reactions, I can get away with taking Benadryl or diphenhydramine. Of course, I have to deal with a significant side effect of it causing me to fall asleep. But for the most severe reactions, such as anaphylaxis when my throat can close up, I need an autoinjector of epinephrine, or an EpiPen. Then, for my particular excursions, I am usually going to altitude, so I need medications for altitude illnesses. Acetazolamide or Diamox can be taken prophylactically as a preventative in smaller doses or in treatment of acute mountain sickness. Dexamethasone helps treat cerebral edema, and there is mixed evidence that nifedipine can prevent or help treat pulmonary edema. So there are the medications I am carrying with me when I go to far off and high altitude places. What am I missing that you travel with? Tell us in the comments. Thanks for watching this video. Please like, subscribe, and share if you want to support us. For more information, you can go to our website at www.shortguysbetaworks.com. You can check out that video I mentioned about acclimatization and altitude illnesses, or you can check out our expedition planning series. We'll see you next week and keep on getting more out of that big outside.